They say breasts are life's gentle affirmations, spoken through flesh and form, and like the form of a mountain, breasts rise with beauty and purpose. But for some, and especially women, the breast has become a source of their predicaments as they seek to boost their self-esteem. For some, the breasts are larger than usual, while others have lost their breast to medical conditions like cancer. On this 100-acre piece of land along the northern bypass in Kenya's capital, Nairobi, lies the ultra-modern 650-bed capacity, state-of-the-art Kenyatta University Teaching, Research and Referral Hospital. This facility offers a ray of hope for those seeking to either restructure or reduce their breasts to their desired size. At the Infectious Disease Unit IDU, we meet Rhoda, not a real name. She lies on her bed, eagerly waiting for her moment to be wheeled to the main theater, where she is scheduled to have a nipple reconstruction surgery.
Things broke loose because my breasts really became so large that they couldn't fit bras. I had to put on a lasso here to get hold of my breast. So that's when I realized that maybe I could get some help from the hospital. And that's when it started giving me pains, the back pains, the hands.
Rhoda was diagnosed with gigantomastia, or the abnormal growth of breasts, a condition that became evident when she gave birth to her second child. She then went for her breast reduction surgery at one of the facilities, but things did not turn out as expected. She not only lost her nipple, her breasts were not proportionate.
So my breast got some infection after that. Not because of the surgery, but because of the aftercare. So after that, it's when I realized that aftercare is also very important. So I got an infection. Then when I went back to hospital after the visits, at some point they had to remove my nipples, which was a very sad moment for me. Oh my God, it lowered my self-esteem. Like, I had a lot of hope. Initially, after the surgery, I was so excited. But now, after it got botched, I didn't even know what to tell the women that I was telling that this is doable. I didn't know what to tell them because they really wanted to see, like, we want to see if this is real. But I couldn't show them my breast because I would even scare them more. Due to the other surgery, they were not even. So now they'll even my breast, they'll do the nipple reconstruction, and give me back my pride as a woman.
Anastasia, not her real name, lost one of her breasts to cancer in June 2024 when she underwent mastectomy, which entails the surgical removal of the entire breast affected with cancer.
My self-esteem without one breast, it was 0.00%. But if I happen to get a breast, it will make a U-turn in my life. Okay, there are some clothes you can't wear because you look weird. You have to stuff some stuff in your bra so that you can look like the cloth can fit, and you can have that at least small self-esteem.
For Ruth Wairimo, her eyes are darted to the clock. There is equally a flicker of impatience in her gaze. She is counting hours before she heads to the theater for a breast reconstruction surgery.
Lakini sasa juu ya weight yangu nilikuwa na weight kubwa kuliko sahi. Akaniambia hawataweza kunimalizia. Walikata tu flaps kwa mgongo. Wakakuja wakaziweka, hata ukaona haiko kubwa sana. Juu ni flaps, haikuwekwa mafuta. Ni flaps peke yake. So Nikamaliza, vile walimaliza nimeheal vizuri. Tena hii mwaka imekuja tena flaps, nini ingine, camp ingine. So kwa hizi flaps inafaa wajaze mafuta. Ndio sasa ikuwe real breast, alafu watakata mahali pengine waeke nipples.
Wairimu was diagnosed with breast cancer in March 2021. She went through all lines of therapy in cancer treatment, but 6 months later, the cancer was detected on the other breast. She lost both her breasts after surgery, and she has not been satisfied with her physique.
Kwa tumbo, kwa hivyo inamaanisha itakuwa flatter, alafu sasa itakuwa mzuri.
But even before these patients go to the theatre, they need the constant attention by a nurse, and Rhoda Wangare is up for the task, as she strongly believes that her services are just as important as the major operation by a surgeon. Rhoda explains the services a patient should access before and even after the breast reduction or breast reconstruction surgery.
Before we started the camp, we had the patient coming into the hospital where we had them screened, do their blood test, just to make sure everything is okay, that they are fit to have this reconstruction surgery. So that's where we started with the patients. So after that, we did that like a week before. Then after that, this week, that's when we started admitting in the patients. So the first contact of the patient is actually the nurse. So we start taking care of the patient all the way from admission. We get them admitted to the wards. We get them ready. We do preoperative care where we let them know what is expected of them, what we are going to do during surgery, and what is also expected of them after surgery. We can give an average of 3 days, a hospital stay of 3 days, but like I've said, it also depends on the patient. There are patients probably that will require more care, so they might need to stay longer, maybe a day longer. There are some who do not need a lot when it comes to reconstruction, but there are some that need a lot. So the ones that need a lot will definitely have a longer stay because they need more care. They need, even according to their medication, their medications are more or even stronger than the rest.
But what happens during a breast reduction and breast reconstruction surgery? First, a patient stops at the receiving area, which is the first point of contact within the theatre complex. Here, the patient is checked in and the theatre nurses verify essential data like consent, surgical site marking, and the patient's well-being.
Then decide whether this is somebody who's fit to have a breast reduction. And we usually just check normal physiological things like your blood levels, what we call the HB, your kidney function tests, whether you're able to withstand anesthesia. We also, in patients who have other comorbid conditions like diabetes, high blood pressure, we need to make sure that those comorbid issues are well controlled before we bring a patient into theatre.
Finally, the nurse collaborates with the surgeon and the anesthesiologist to address any questions or concerns. Thereafter, the patient is wheeled to the operating room. During the breast reduction surgery, the surgery is performed under general anesthesia. Then, the surgeon makes incisions or a surgical cut around the areola or the dark skin surrounding the nipple. The surgical cut is made vertically down to the breast crease and horizontally along the breast crease. Thereafter, excess skin, fat, and tissue are removed to reduce the size of the breast. Then the surgeons reshape the breast tissue, whereby the remaining breast tissue is lifted, shaped, and sculpted to create a smaller and more proportionate bust. The nipple is then moved to a higher portion on the chest. The incisions are then closed with stitches. Finally, gauze dressing, which is a thin, loosely woven fabric typically made of cotton, is used to protect and cover the breast.
Usually when they're on the operating table, we've already done our markings. Okay, markings just means we draw on the chest of the patient the areas where we're going to operate. That's usually the main thing. Okay, and then when the patient is on table, usually we'll have 2 teams of surgeons and a team of nurses as well. one on each side of the breast, working together to get the result that we want. And it involves making cuts and incisions and reducing the size of the breast by removing the bulk of the breast and preserving as much blood supply to the breast as possible, so that you can achieve two things. So one is that you have a breast that looks good, that's aesthetically pleasing, and number two, you have a breast that is reduced in size, and that reduction in size takes away a lot of the symptoms and the stigma that comes with having large breasts. The risks, though, they are not high, and they make a very small percentage of the cases that we do, but there are common things like bleeding, infection can happen. You can have issues with wound healing, especially if you have other issues like obesity and diabetes involved. You could have complications resulting from poor blood supply to the breast itself.
We also do other surgeries like silicone breast implants. We are doing breast lifts, and we are also doing for patients who are genetically born with small breast. We're also able to give them the normal size breast according to their age and body structure.
And that involves us removing anywhere between 300 grams all the way to 1.5. In very severe cases, even 2 kilos you can safely remove, provided you're using the correct techniques and you're having it done by somebody who's qualified to do so.
We meet Tamara Modoni. She is radiating with joy. She was ailing from gigantomastia, or the abnormal growth of breasts.
I came in here because I was going for the breast reduction. It has been giving me a lot of complication issues for since I guess when I time it's 6 years. So I couldn't stay without a bra because of the pains. When I take it off, it's very painful. I had lower back pains.
But now, Tamara feels like a huge load has been lifted off her chest, quite literally. It is now more than 8 hours after her surgery.
Because you don't know what awaits in the future. But I had to go for it. I preferred having the scars than having the heavy weight on my chest. I have no pain. They give us good painkillers to sustain the pain. The services are very okay. As for now, I can't complain. There's no pain at all.
Gigantomastia is generally considered a rare condition globally, with the cases linked to pregnancy being rarer, with a prevalence of approximately 1 in 28,000 pregnancies.
I'd like to encourage, I know this is one thing that kills self-esteem, and also it's hard because if you're actually my age, very young, you'll have people mocking you, people being like, you look like a mother or a parent, of which I took some negatives as my positive thing.
Fortunately, a patient who has undergone breast reduction can breastfeed, as Dr. Were, a plastic surgeon, now explains.
In fact, yesterday I was talking to one of the patients we did the last camp 1 year ago. She got pregnant 3 months after the reduction mammoplasty. She was telling me she's having a lot of milk, a bit of challenges in the the baby lacking to the breast, but then that can be sorted out. So you are able to perfectly breastfeed. If you do a breast augmentation for you, if you want bigger size, if you do a reduction mammoplasty, you can perfectly be able to breastfeed.
At the operating room 4, a breast reconstruction surgery is underway. A team of over 8 plastic surgeons are operating on a patient. First, the patient is prepared with anesthesia to ensure she is comfortable and pain-free during the procedure. Then, the patient is positioned on the operating table, often on their back, for better access to the surgical area. The surgical site is then cleaned and sterilized to minimize the risk of infection. Thereafter, the vital signs are continuously monitored during the surgery.
Normally, when you go for breast, let's say you have a mastectomy at the breast clinic here in KTRH, we give you between 6 months, at least minimum, so that you have completed your chemotherapy and radiotherapy and you have healed, so then we can be able to do the reconstruction safely. The surgery takes between 4, maximum 6 hours, and you're able to use your own body tissues or use implants to recreate your breast mound.
During the reconstruction, the surgeons make an incision to create a pocket for the implant, and then the surgeon transfers a section of skin, muscle, fat and blood vessels from another part of the body, preferably the abdomen, back or thighs, to the chest area where a new breast mound is created.
Either do an autologous reconstruction, meaning using the patient's own tissues, or sometimes we use a silicone implant to reconstruct the breast. So that's what we did today morning. We had a patient who'd had mastectomy about 2 years ago. So we used the tissues of the lower abdomen to reconstruct a breast. You can use from the inner thigh, you can use from the back as well. Those are the commonest sites that we normally use. But for us, it's the abdomen and the back which is commonly used here.
And the implant reconstruction is very good for women who are smaller, who have smaller breasts, but they also have smaller abdominal walls, so they don't have as much of their own tissue to do a reconstruction. So we do a lot of implant-based reconstruction as well.
A thin tube or a drain may be inserted under the skin to drain fluid and blood as the patient recovers. Then the incisions are closed with stitches or adhesive strips.
Immediately after the surgery, if it's an autologous, meaning we use the body's own tissues, it doesn't have sensation. The flap will not have sensation. But later on, as the body heals, there will be some nerves that grow into the flap, so there will be some sensation. And initially, we don't reconstruct the nipple at the same sitting, so we just reconstruct the breast. Then a few weeks later, once they're completely healed, we come in and reconstruct the nipple.
After the surgery, the patient is monitored in a recovery area and instructions for post-operative care provided. Scars from the surgery will gradually fade and flatten over time.
Then they're in the ward for about 2 nights. When we discharge them, we remove the drains, but they have dressings for about 2 weeks. So it takes about 2 weeks for the wounds to heal. But things like heavy lifting, especially for the ones who've had abdominal surgery, we don't allow them to lift anything heavy for at least 6 weeks.
Yeah. So normally what we tell our patients is to avoid smoking at least 4 to 6 weeks before the surgery. Ensure if they have diabetes or hypertension, then it's well controlled. We tell them between the first 8 to 12 weeks to wear compression garments to minimize their exercise. You can do the 10,000 steps, but avoid a lot of exercise that you have to lift your arms and stuff. Always come for regular checkup in the clinic, at least within the first 3 months every month, and then 6 months, then yearly, until you fully recover, so that you can also do surveillance and ensure there's no recurrence of the cancer.
We before assess the patients, we saw the patients the day before, we check the patients, we talk with the patients about what are the desires of the patient and what we can provide to the patients, and then we plan the surgery for the next day.
But like any other surgery, breast reconstruction and breast reduction surgeries have their limitations, top on the list being the costs.
We are lucky that the Social Health Insurance Fund is able to cater for some of the cost, part of the cost of these surgeries, because normally a breast reconstruction will cost between 250,000 to as high as 650,000, depending on the type of reconstruction you do. So that pushes patients away, but what we encourage them to do is to get an insurance cover, because this is not a cosmetic procedure, but then it's a reconstructive procedure which is covered by insurance. And we can also have payment plans where you're able to deposit money over those 6 months as you undergo your chemo and radiotherapy, and then once you have the full amount, then we do the surgery.
The number of Kenyans undergoing breast reconstruction surgery is relatively low, with only 2.8% of women undergoing breast reconstruction after mastectomy. However, the number is growing.
And then the other possible complication is what we call flap compromise or flap failure, because you see you're lifting the tissues from their normal place to a different part of the body, and now you're raising it, instead of how it's usually vascularized from all around, you're raising it on only one vessel. So sometimes that vessel can get compromised and it can affect the flap.
Sometimes the patients will develop what's known as a DVT or a blood clot in their leg post-reconstruction because they're not moving around. And it's not really a complication, but patients do need to be made aware that there is a recovery after these types of surgeries.
According to a 2023 report by the American Society of Plastic Surgeons, in the realm of plastic surgery, a notable trend involves men undergoing breast reduction and reconstruction procedures, particularly for conditions like gynecomastia. This trend is reflected in the growing number of men seeking these surgeries for both cosmetic and psychological reasons. According to the report, the number of men who have undergone breast reduction surgeries rose from 24,517 in 2022 to 25,888 in 2023.
And for the men who have gynecomastia, we call male boobs, then you're also able to address that. For gigantomastia, luckily it's also covered by SHA. So we're able to actually reduce the size of the breast and ensure that you live a normal life where you don't have a lot of disease as a result of having big breasts. So men also have breast cancer. 4 to 5% of men have issues of breast cancer where we're able to remove the lump and do reconstruction for them. Some men, because of using steroids or genetic error, then get also male boobs, which they have breasts that look like one for a woman. So we're able also to correct that well and give the man the chest of a man.
And even as facilities witness an influx of patients seeking plastic surgeries, medics warn of the impending danger over a surging number of quack doctors, urging Kenyans to be on the lookout.
It's a common occurrence in Nairobi, and that's why we normally ask if you are seeking for a cosmetic, plastic surgery, or even reconstructive. The first question you need to ask is that person doing the surgery board certified plastic surgeon, because they're the ones who do the breast reconstruction. 2 is the facility that they're working on, like KTRH or their private clinics, recognized for doing plastic surgery cases. And then 3, as a patient, you have a responsibility to actually discuss your management plan with the actual surgeon who's going to do your surgery. So, and KMPDC has actually put a mechanism where you can actually send a code and be able to check whether that person is a board certified plastic surgeon and the facility is registered.
Plastic surgery stands at the intersection of artistry and science, offering transformative solutions that go beyond physical changes. And for patients who have just had their breast reduction and reconstruction surgeries here at the KU Referral Hospital, they all might have their individual unique journey, but to all of them, this procedure is a metamorphosis that occurs with courage, resilience, and the pursuit of self-actualization. This surgery offers a ray of hope to women who seek to restore their dignity and self-esteem through breast reduction and breast reconstruction. Elizabeth Atieno, TV47, Nairobi.